Good day, I'm Carrie-Ann Smith and this is your JIS News for Friday, May 20. The Jamaican and Mexican governments have signed an agreement which aims to prevent double taxation of the same income in both countries. The agreement on the avoidance of double taxation and the prevention of fiscal evasion was signed by Jamaica's Foreign Affairs Minister, Senator Camina Johnson-Smith, and Mexican Foreign Minister Claudia Ruiz Maceo. It was signed in Mexico City, where Senator Johnson-Smith had led a delegation to the 8th Mexico-Jamaica Binational Commission from May 17 to 18. While there, the minister also signed an MOU on the establishment of a Mexican chair at the University of the West Indies and the renewal of the collaboration agreement between the National Autonomous University of Mexico and UWI. The Jamaica-Mexico Binational Commission is a bilateral mechanism established to promote enhanced political consultations and cooperation between the two countries. This week's meeting coincided with the celebration of the 50th anniversary of the establishment of diplomatic relations between Mexico and Jamaica. During the visit, Minister Johnson-Smith also met with members of the Mexican private sector and encouraged closer economic and commercial cooperation between both countries. The Ministry of Health is offering free yellow fever vaccination to Jamaican athletes, their management team, and their families who will be traveling to Brazil for the upcoming Summer Olympics. The ministry says the offer is a precautionary measure that's being taken in light of the risk of yellow fever transmission in Brazil. Other persons intending to travel to the South American country are being advised to get vaccinated. The advisory also applies to persons traveling to Angola, Peru, China, Kenya, the Congo, or any other yellow fever affected areas. Jamaica, like several other countries, requires proof of vaccination from travelers coming from yellow fever endemic countries, as well as those currently experiencing active transmission. Travelers are not allowed to enter the country without this vaccination certificate, and as a result, the ministry says it recently detained some Chinese nationals at the Sangster International Airport for failure to show proof of their yellow fever vaccination. Locally, yellow fever vaccines are available and administered at the Comprehensive Health Center in Kingston and the Montego Bay Type 5 Health Center in St. James on a schedule. The cost is $1,500 per vaccine, and vaccines should be done at least 10 days prior to travel. Yellow fever is an acute illness caused by the yellow fever virus, which is transmitted by the bite of an infected Aedes aegypti mosquito, the same vector that transmits the chikungunya, dengue, and Zika viruses. Yellow fever is a Class 1 notifiable disease and must be reported to the Ministry of Health within 24 hours on suspicion by a healthcare professional. Individuals may call the Ministry of Health or the nearest health center for more information. The Andrew Holness administration is pushing for a major overhaul of the public health sector. Portfolio Minister Dr. Christopher Tufton says the time is ripe for reviewing the processes to preserve what works and to enhance and improve where challenges exist.
There are two areas of review that I have asked to be done. They were on the drawing board before my time, but I'm trying to make them speedier. One is a 10-year development plan for public health and public health administration that's being funded by the IDB.
The second area for review involves examining the cost of providing healthcare in order to ensure greater value based on available resources. That review is being funded by the World Bank. The health minister was speaking at the 58th annual conference of the Jamaica Association of Surgeons. The Jamaica Social Investment Fund, JIS, will be investing $2 million in this year's Labor Day celebrations. Social Development Manager Mona Suho says the initiative represents a continuation of JIS's investment in promoting a healthy environment. In addition to money, JIS will be providing an integrated package of services.
Training and employment of 165 environmental wardens. The construction of skip enclosures, 130 enclosures, 660 waste separation receptacles and 2,000 drums, as well as 18 activities held in communities to beautify the natural environment.
18 communities will each receive up to $100,000 under the Integrated Community Development Project. The Ministry of Health will also be getting assistance to continue its cleanup exercise in the fight against the spread of the Zika virus.
JIS has, I think, appropriately come on because they are a development partner, and health is a development imperative. You cannot develop your country if you don't have health.
Meanwhile, residents of Portland are being urged to get involved in the Ministry of Health's Mosquito Search and Destroy campaign. The ministry's operation team was in the parish recently, sensitizing residents and carrying out cleanup exercises. It was part of a broader initiative aimed at reducing the number of mosquito breeding sites across the island to protect citizens against mosquito-related illnesses. These include Zika, chikungunya, dengue, and yellow fever.
The efforts today will help with ridding our communities of the potential of having any of those 4 illnesses that were just pointed out. So you can kill 4 birds with 1 stone if you take it seriously.
Chief Medical Officer Dr. Winston Delahaye says citizens' participation is crucial to reducing the high number of breeding sites for the Aedes aegypti mosquito in communities across the island.
In every parish in Jamaica, Portland not excluded, we have areas with Aedes indices of 40%, 50%, and even 60%. In other words, of every 10 homes you go into, 5, 6, sometimes in some places 7 of them have breeding sites for these mosquitoes.
Dr. Delahaye pointed out that the recommendation of the World Health Organization is for the Aedes index, that's the number of breeding sites, to be reduced to between 5 and 10% to prevent any major outbreak of mosquito-related illnesses. And finally, the Caribbean Development Bank, CDB, has approved 2 major energy projects to help Caribbean countries increase their efficiency in this area. The announcement was made by the bank's president, Dr. Warren Smith, at the opening ceremony of the 46th annual CDB meeting held in Montego Bay.
One project will finance the installation of LED street lamps in St. Lucia, which will reduce energy consumption, and the total quantity of oil imports, as well as lower the street lighting electricity bill by almost 60%.
He added that the second was an exploratory drilling project for geothermal energy in St. Vincent and the Grenadines.
This is the first of what we expect to be a number of other developments in the geothermal energy sector as the OECS countries move aggressively to develop this abundant indigenous energy resource.
And that's it for JIS News today. I'm Carrie Ann Smith. Thanks for watching.